Chronic pain is a complex and often misunderstood medical issue that affects millions worldwide. While much attention is given to diagnosing and treating pain, the crucial role of preventive medicine is sometimes overlooked. Preventive medicine aims to stop diseases before they start or to reduce their complications after they occur. In the context of chronic pain, this approach is vital. By focusing on prevention, we can reduce the incidence of debilitating conditions and improve overall health outcomes. Today, we'll explore how preventive strategies, especially vaccination, can make a significant difference in the fight against chronic pain. Herpes zoster, commonly known as shingles, is a neurocutaneous disease caused by the reactivation of the varicella zoster virus. This condition leads to a painful, blistering rash and can result in serious complications. One of the most concerning outcomes is post-herpetic neuralgia, or PHN, which can persist for months or even years. The risk of developing PHN increases with age, especially in those over 50, and is higher in patients who experience severe pain or extensive rashes during the initial outbreak. Understanding herpes zoster is the first step in preventing its long-term effects. Post-herpetic neuralgia, or PHN, is a severe complication of herpes zoster that can drastically reduce a patient's quality of life. PHN can cause persistent pain, anorexia, weight loss, depression, and even withdrawal from social activities and employment. For some, it leads to a loss of independence. Unfortunately, once PHN develops, treatment options are limited and often only moderately effective, with side effects that can further impact daily living. This highlights the importance of prevention as the best strategy to avoid the devastating consequences of PHN. Preventive medicine is not just about avoiding illness, it's about protecting quality of life. In the case of herpes zoster and PHN, prevention can mean the difference between years of suffering and a healthy, active lifestyle. By focusing on preventive strategies, healthcare providers can help patients avoid the onset of chronic pain and its complications. This proactive approach is especially important for older adults and those with weakened immune systems, who are at higher risk for both herpes zoster and PHN. Vaccines have revolutionized the way we approach disease prevention. The first vaccine for herpes zoster, known as the live zoster vaccine (LZV) or Zostavac, was introduced in 2006. While effective, it could not be used in immunocompromised patients, leaving a significant gap in protection. This challenge led to the development of a new non-live vaccine, Shingrix. The evolution of these vaccines marks a major step forward in preventive medicine, offering hope to those most at risk. Shingrix is a non-live recombinant vaccine developed by GlaxoSmithKline. It contains a recombinant glycoprotein E and a novel adjuvant, ASO1B, designed to boost the immune response. Approved by the FDA in 2017, Shingrix represents a significant advancement in the prevention of herpes zoster and its complications. Unlike the earlier live vaccine, Shingrix can be safely administered to immunocompromised patients, making it a valuable tool in preventive medicine. Shingrix is administered as a 2-dose series, with each dose containing 0.5 ml and given intramuscularly 2 to 6 months apart. The vaccine is designed to maintain immunity for up to 9 years, providing long-lasting protection against herpes zoster and post-herpetic neuralgia. Most side effects are mild, such as pain or redness at the injection site, making it a safe and effective option for most adults aged 50 and older. All adults aged 50 years and older are recommended to receive the Shingrix vaccine. This includes individuals who are immunocompromised, such as those with cancer or on immunosuppressive medications. Even patients who receive steroids as part of their treatment can benefit from vaccination. Identifying and vaccinating these high-risk groups is essential to prevent herpes zoster and its complications. Preventing herpes zoster and PHN has a profound impact on patients' quality of life. By avoiding the pain and complications associated with these conditions, individuals can maintain their independence, continue working, and enjoy social activities. Vaccination not only protects physical health but also supports mental and emotional well-being, reducing the risk of depression and social isolation. National Advisory Committee on Immunization Practices recommends Shingrix as the standard vaccine for herpes zoster prevention in adults aged 50 and above. These guidelines are based on extensive research and clinical trials demonstrating the vaccine's safety and effectiveness. Following these recommendations ensures that patients receive the best possible protection against herpes zoster and PHN. Some patients may have concerns about vaccine safety or side effects. It's important to reassure them that Shingrix has been thoroughly tested and is associated with only minor side effects such as local pain or redness. The benefits of vaccination far outweigh the risks, especially for those at higher risk of developing PHN. Open communication and education are key to increasing vaccine acceptance. Healthcare providers play a crucial role in identifying patients who would benefit most from vaccination. By routinely assessing patients' risk factors and discussing preventive options, providers can ensure that more individuals are protected from herpes zoster and PHN. This proactive approach is especially important in pain management and palliative care settings, where prevention can make a significant difference. Preventing herpes zoster and PHN is not just a personal health issue, it has global implications. By reducing the incidence of these conditions, we can decrease the burden on healthcare systems, lower healthcare costs, and improve population health outcomes. Vaccination campaigns and public health initiatives play a vital role in achieving these goals worldwide. As research continues, new preventive strategies and vaccines may emerge to further reduce the risk of chronic pain and its complications. Staying informed about the latest developments in preventive medicine ensures that patients receive the most up-to-date care. The future holds promise for even more effective ways to protect against diseases like herpes zoster and PHN. Summary: chronic pain and its complications, such as post-herpetic neuralgia, can have a devastating impact on individuals and society. Preventive medicine, particularly vaccination with Shingrix, offers a powerful tool to reduce this burden. By embracing prevention, we can help patients maintain their quality of life, reduce healthcare costs, and build a healthier future for all. Let's continue to prioritize preventive strategies in our approach to chronic pain management.